All right, hello everybody, and welcome to another Friday Live. I can't believe it's been 6 months now of me doing these almost every Friday. So it's been really fun connecting with our LPF trainers, instructors from all over the US. I started the very first one, I think it was that first Friday in January. So we're already now in July, and I'm going to keep doing this. So thankful for all of you joining. Hello, everybody. And hopefully you're really enjoying these lives. I just thought it was a great way for people to learn a little bit about low pressure fitness, maybe find a provider in their area and see how low pressure fitness could be used for so many different disciplines. It can be used in so many different ways. And I just absolutely love it. So our guest today is going to be Justine Calderwood. She is a pelvic health physical therapist from Colorado Springs. So I was just out in Colorado a couple weeks ago. Beautiful area out there. So I'm excited for her to join and talk a little bit about her journey and her experience. Justine owns a private practice called the Healing Spot Physical Therapy. And so let's invite her. So give me a second here as we bring Justine on. Hello, everybody. Good to see you all. Thanks for joining. Hey, Justine.
Hello. How are you, Becky?
I'm good. How are you?
I'm doing well.
Good.
It's Friday.
Friday. That's always good, right? That's why I chose these. It's my lunch break time here in New Jersey on the East Coast. I know it's still mid-morning for you there in Colorado.
Yes.
But I was just telling everybody about, this is actually, it's been 6 months now of me doing these lives. And so I've done almost 22 of them. And so it's been a lot of fun connecting with our LPF trainers, just like you. Like we met a few years ago, right? And
Yes.
you did the whole series. I think it was it during the pandemic, so you did the online series?
Yeah, it was. End of 2020, I took the Low Pressure Fitness 1, and then I finished up early 2021.
Yeah.
I took them, pretty much back to back as soon as I could.
So it's so good to connect with you. So I just briefly said you were a pelvic floor physical therapist in Colorado Springs area. The Healing Spot Physical Therapy is your private practice. And so I would love for you to take it away and tell us a little bit about your journey with low pressure fitness. And then we can kind of segue into, I know a topic that you're very passionate about, very experienced with, is working with the postpartum patient, the postpartum client.
Yes.
So tell us all about you and your LPF journey.
Okay, so yes, I'm a pelvic floor physical therapist. I've been practicing for 21 years. And so prior to taking LPF 1, I started having patients ask me about if I knew hypopressives, if I knew how to do this. And especially, I can think of 2 patients that really stuck out that had prolapse. And they were asking me about it. And I had happened to have taken like one of my manual courses. One of the PTs that was in my course back in, I think it was 2017 or 2018. So it took me a little bit, but she was using low pressure fitness or hypopressives, and she was talking about how it was really helping with her diastasis recti patients. And so I was kind of intrigued. And then when my patients started asking me if I knew anybody, and it really, for me, when one of my patients found another practitioner, the other one started using some like tutorials from YouTube, but when the other one started seeking out a different practitioner, I was like, whoa, hold on. I need to step up my game here, and I need to learn this. And yeah, the pandemic actually, I think, helped with that, because I was looking for classes and trying to get out of state, and it was just, it didn't work out. Mm-hmm. So when you guys started offering them online, it was the perfect chance for me to jump aboard and and to learn it and to bring it back into with my patients. And it's been a really good thing for me and for them, obviously. Yeah,
exactly. That's awesome. That's so great. Yeah. And you you take classes with us now.
Yes.
you're really continuing to try. So there's a big difference between kind of, you learn it, you take the course, but I think to put it into practice and to put it into action and being like trying to actually do it yourself and feel it in your body and continue to excel at it, right? To continue to evolve with it. So not only you evolving as the person, teaching it to your client as the trainer, but you also evolving within your own body. Because I've seen that tremendously with you now over the years that we've known each other and things like that.
Yeah, and I will say I took a little bit of a break because I've told people, like, I almost had this love-hate relationship with LPF, and I think it's because I love it because it's challenging, but I also sometimes hate it because it's so technical and challenging. But and I've gotten kind of mixed things with patients. Some people absolutely love it, and there's other patients that don't want anything. They're like, no. So I think for me, it's been trying to find out, how does this actually work in my own life? Because I've been a long distance runner in the past, very much cardio. I love weight training, so going to the gym. And so for me personally, I think it was a matter of figuring out, how does this actually work with other styles of exercise that worked for me, so I could bring that into my experience with patients. And it took me just a little bit to kind of figure that out, so to speak.
Yeah.
So I'm back into, definitely taking classes again and using myself in a way as a guinea pig. But my patients, now that I'm a little more accepting and figuring that out, I find that my patients are also like really embracing what it is I'm teaching them, and they're actually really, really loving it. So yeah.
That's great. And I actually so appreciate your honest feedback with that, because it's not for everybody, and I hope people don't realize they're like, oh my God, this is for everybody. Everybody must do this. This is the only thing you need to do. This is going to solve every problem that you've ever had. And that's just not reality, and so sometimes you go through these moments, and sometimes you're more accepting to learning them at different points, depending on so many other factors in your life. And I think for you, as you said, trying to figure out, well, I also want to do these other things. And I think those other things are important. They're good. You want to do those other things. We need to weight lift. We, want to run for so many other health benefits. Movement's movement, and it's amazing. But I think just finding where you can put it in and what your then connection is with it. Just like my connection with it is maybe a very different thing or reason or feeling, yours would be, what's unique to you, and do that. And I think when you love that, you say when you were more accepting of it, you could then express it better maybe to the client and patient and get them to understand it. Same thing happens with me. I have some clients that absolutely love it. That is going to be their strategy that they are going to use and do, and they're going to continue and adopt it and have it as part of their lifestyle for the rest of their life. And there's some that are like, yeah, I don't know if this works for me. I'm not really into it, or we break it down even more and we take some of those components of it, and can we at least do that? And that's what I find as a PT. Sometimes I got to break it down and say, well, I'm going to use some of these cues, but maybe we don't do the apnea, or maybe we don't do different things, because a lot of the solid foundations of what we teach in low pressure fitness, right, can be so beneficial from even the very breath mechanical posture standpoint, right?
Yeah. Absolutely. I take elements of it. And for some of my patients, they're doing all of it. They have really embraced it. They want to know as much as I can provide to them, the poses, and take me through a sequence. And that's what we do. And then other people, I'm using elements of it where, the mobility through the diaphragm and that breath work, maybe that's what we're working on. And maybe we may or may not get to the rest of it, but that's helping them. And they may be more, I ask my patients, like, what's your ideal workout look like? How much time do you have? What do you enjoy doing? And I try to take that into consideration, because I'm not here to convince somebody, hey, stop doing that in favor of this. That's not my job. My job really is to listen to them and use the tools that I have available, and the skills. So
Exactly, exactly. So let's talk about, because I know with your background, a lot of the training that you have, you're putting up really great content and information on social media and Instagram. You shine, and the postpartum population is one in which you're very experienced with working with treating. So tell us a little bit, talk us through about what you do and what are some of the things that you look at when you're thinking about a postpartum evaluation. What are some of the key things that you're trying to help people with when they're after they've had a baby, and being able to kind of restore and recover from that?
Yeah. So I look at like posture, for instance. What's their body doing? Where are those lengthened muscles? Where is their pelvis and their rib cage? And then I'm looking at a lot of mobility throughout the pelvis. That's kind of where I start. And I might start with a lot of manual work and helping with that awareness of, hey, this is where your body's moving, this is where it's not. And then addressing any like I always look at an inner core thing. So pelvic floor, those transverse abdominis, like what's actually going on. So once we can get a good solid foundation of the pelvis, I really look at that being the center of the body. It's going to influence the spine all the way up to the head. It's going to influence down into the feet. So if we can get that balanced and moving well, then we have a better foundation to work with as far as strengthening and rebuilding things. So from there, I look at, what's the breath like? Where are they actually breathing into in the pressure management, right? That's going to make a big deal or big influence on things, and starting to activate into the core. But yeah, going back to the manual work, I mean, there's plenty of things that I do to help close down gaps. For instance, a lot of people come in worried about diastasis. I know this is a big thing on social media. They're worried about if it's closing down, how big their gap is. And I'm really trying to educate them. It's really about the function, like what's actually working, what's not, and let's address that. And then we get into, we're getting into movement. I'm big on education. So I want my patients to know what's going on in their body and how can I be a guide for that, but what also can they do at home? And it's kind of a mixture of those things. And yeah, definitely bring low pressure fitness into that, like I said, in different elements. And for some, it's like building, I talk about like building a house. We first got to get the good foundation built. Then we start to build those side walls, and and then we kind of go into a little bit higher exercise with putting it all together.
Yeah, it's a great foundational concept. And again, I love it for the working with the postpartum population. As you said, restoring that breath core connection, restoring alignment in the sense of where they are in space, and depending on the mode of delivery for your client, right? Did they have a vaginal birth? Did they have a cesarean birth? And differences with that? And I got a thought in my head, because we'll come back to it, because I know a lot of people ask, when can they start doing low pressure fitness after they've had a baby? But just loving it for, in many ways, what are some of the concerns that we have for, or the postpartum patient might have, is some of them are like, again, my abdomen, right? I want to work on connecting and strengthening into that. Might have a diastasis recti. July's Diastasis Recti Awareness Month, right?
Okay.
So we got to talk about that.
I didn't know that. Oh,
Yeah.
okay.
Pretty sure it is. June was Prolapse Awareness Month. So, but prolapse could be something that someone's experienced some bowel and bladder issues, where they've lost a bit of control. Urinary incontinence or leaking is happening. Sometimes fecal incontinence. Sometimes the complete opposite, and they're now having some constipation or difficulty being able to get poop out. Obstetric traumas into the vaginal area, into the vulvovaginal area, that pelvic floor, for maybe an episiotomy or tearing. All of that stuff. It's a lot to look at, a lot to do. So I think from us being pelvic PTs, right, is the advocacy that everyone should see a pelvic health therapist, right? Or occupational therapist that does pelvic floor too as well.
Yeah. Yes, absolutely. At least to get things checked out, because I think people use pain as their guide, and that's not always, it's not the only indicator that something's going on. I mean, as we know, you can have a prolapse and be asymptomatic and not have anything thing until, you're starting to notice maybe that bulge or it becomes symptomatic. So what can we help with preventatively or catching things even before maybe the patient knows? So.
That's why I think it's so imperative, for everyone at least seek out, a pelvic health therapist to guide you on all of these things that we look at and we can help with and educate on and be able to guide you to getting back to, running or athletic performance or whatever it is in life you want to do in a way you feel connected and strong and posturing and functioning in a way that empowers you, right?
Yeah, absolutely. And it's not always about exercise. Not everybody that walks in my door has an exercise goal or cares about exercise, but they care about taking care of their baby, I guarantee that, or their toddler, or pushing the stroller, being active with their family and not feeling like they're just sitting on the sidelines, and watching their family go through life. They want to be active in some way. So it doesn't have to necessarily be, running or something athletic, but yeah, we need to be able to move and do it well without, like you're saying, like without leaking, without worrying that things are going to fall out or that we're going to do any more harm. So
exactly. Yeah. So let's talk a bit about diastasis, for people, the idea of that thinning, that laxity a bit in between that midline, between the heads of the rectus abdominis, that linea alba connection. You'll have to tell me your experience with it, but I've been getting pretty amazing results for my patients who have a little bit of that connective tissue issue there. They're not loading very well into it. The body hasn't turned back on in that sense of getting that tensioning appropriately. And when we do the LPF and the hypopressives, the low pressure fitness, the abdominal vacuum, all those combinations between the posture and between the breath, it absolutely makes a huge difference. Are you noticing that?
Yeah, absolutely. Yeah, just the connection with knowing where their body is at in space. And I've even checked people like internally going into the vaginal, like checking the pelvic floor and have them, okay, just do a regular Kegel and now do the hypopressive vacuum. And I can feel a difference. I know that's more subjective. I don't have something hooked up to them, but I can feel the difference with that engagement of the pelvic floor. And I can see it too throughout their abdomen. And it's great.
And I have a rehab ultrasound that I do it with. So
I've seen it.
Objectively looking at it from that standpoint, and like I have it up on Instagram too with it. It's pretty intense. It's a huge difference that you see. But the whole idea is that we're creating and giving attention for the body to heal and respond to those stresses placed on it in a way, maybe we want to say it wants to tension and get stronger so that we can better manage forces, right? We can better translate forces. And what I see that happens is it's almost like this triplanar motion that happens. So there's tensioning coming from all different directions onto this linea alba when we do the low pressure fitness in the vacuum. And it's really interesting. I check, I palpate to be able to feel with my hand where I can feel that tensioning happening or lack of tensioning. And what's been cool is I've been doing a lot of manual therapy techniques as well. And I'm sure you do too, with the connection through the abdomen, the obliques, the rectus abdominis, and then retesting, having them redo it again and getting a little bit more of that almost brain body connection with that neuromuscular, turning it back on. It's been really cool to see a lot of great improvements in a relatively, I think, short period of time. Right? And I'm probably saying
I agree.
Patients about once a week, maybe 8 to 12 weeks, and it's their separations are coming back pretty tremendously.
I was gonna say too, I do the same thing. Like I focus on what manual work can I do to help this, but that's what I love. Like I do a lot of myofascial release with my patients. I have for years, and what I love about low pressure fitness is that myofascial component, and I can feel that in my own body, just that lengthening out and that opening up of the connective tissue. And when it comes to diastasis, it might be like some people might think, well, isn't it already weakened? We don't want to, do something with that. It's really about the outer part, right? The obliques and that, and allowing it to have the mobility it needs, and then also the coordination and the strength. So I love doing them together, the manual work, and then incorporating the exercise with it.
Yeah, exactly. So let's let our viewers know, because some are like, okay, well, maybe I just had a baby. When can I start doing low pressure fitness? What are your thoughts on it?
So that's a great question. I mean, it depends on what part. We can take, if somebody had a C-section birth, for instance, we wouldn't really want to be doing the apnea, the abdominal vacuum for about 3 months. But are there elements that we can start? Can't we benefit from, getting those tissues prepared and breathing in with a diaphragm? So I tell people after birth, like, I can see you as soon as you feel comfortable getting out. There's usually something we can work on. And sometimes that's just getting the nervous system calmed down and reconnecting in with your body. But really, we tailor that based on what's going on and where you're at. So I don't think there's a too early, other than maybe, like if you've had a C-section birth and you're going to get out with your baby and carry a car seat, that's the concern that I would have. Not necessarily that what you're going to be doing in the treatment room is going to be too much, because we're going to tailor that to where your state of healing is.
Yeah, I agree with you on that. Yeah, I mean, usually, I guess from a surgical approach, there's a lot of fascial change that happens when we vacuum, when we actually do that correct apnea rib cage opening. And so we do want to respect healing. So that's why with someone who's had a cesarean birth or any abdominal surgery, will often wait. I wait about maybe 10 to 12 weeks. But as you said, I am then doing additional things. So we're doing low pressure fitness from a postural standpoint, from the poses, from the breathing. And how can I, if I can't use the vacuum with someone, how could I then progress them with the breathing? And sometimes this comes in with, I will use some breath trainers with my clients that they start to work at it. Sometimes even a straw breathing gives them that little bit of resistance that it can fire up and get those muscles kind of connecting and the brain connecting again with that part of the body. So as early as them feeling comfortable coming in, we're starting to think about breathing and at least a postural cue that I'm starting to work with people. But I think there's so many benefits of low pressure fitness. Again, our topic today was postpartum, but this can be for benefits so many people, so many physiologic reasons, right? And one of the ones you just said is sometimes we're just helping calm nervous system a bit, right? And
yes,
this could
we could all use that, right?
We could all use that.
This day and age.
This is why I do it. I was like, I need to calm my nervous system down, right? That's why I do it. Yeah, that is one thing. And it's funny because I actually just started doing it with my husband, and he was like, I've been doing low pressure fitness for 6 years, and he's tried to avoid it for a very long time. And he's like, I'm going to do it. I'm finally going to do it. And I did it with him. And we only did 2 poses. We did some of the vacuum. We did the nice rest breathing. And he looks at me and he goes, oh, I feel calmer. I'm like, it's great.
Well, that's what happens when you breathe with a diaphragm and you connect with your body.
Exactly. So sometimes it's just about that. And that's the one way we can tap into our nervous system so quickly, right, is through breathing. And I think it's starting to gain attention these days. Everyone's talking about how we should be breathing and the vagal nerve. And, in low pressure fitness, we call that the low pressure fitness nerve or the low pressure nerve. Because we're working on that, right? We're that and the best friends with the diaphragm kind of a thing. So
yeah, absolutely. As it comes down. Yeah,
but that's great. I was telling everybody I was out in Colorado just a couple weeks ago. I'm sorry we didn't get to meet in person.
Yeah, I was in Cozumel at the time. I was living it up in Mexico.
Oh, that's nice. That's nice. It was actually cold where I went in Colorado because we were up in with the mountains. But Colorado Springs is beautiful. How long have you been in that area?
Since 2015. And yeah, I've really enjoyed it. I will say the challenge with Colorado and low pressure fitness, I don't know if you found this, is the altitude. I know you were in Denver when you were teaching the class, so it's a little, maybe a little lower than where we're at here in Colorado Springs. But like I live up at close to 9,000 feet elevation where I live, and I noticed that that affects my ability to hold a vacuum. And when I go to somewhere like Mexico and I come down a little lower, I have a better capacity.
Isn't that interesting?
Did you find that to be true for you at all?
I did. When I teach, I don't vacuum that much.
Yeah.
Because I'm always talking and teaching and all that stuff. But I did okay, believe it or not. But that's why I'm saying you need to come to us here in New
Yeah.
Jersey. Next wall course, I want you to come out
too.
when we host
Yeah.
in person. But yeah, I think we're pretty much sea level here. So you'll be like a champ with holding those apnea.
Well, I don't know about that, but probably better than where I live.
Yeah.
I do my best.
Yeah. Tell us about your so you're at the Healing Spot Physical Therapy is the name of your practice,
Yep.
right?
Yep. Yeah. So I've been, I moved here, yeah, in Colorado 2015, and I opened my practice in 2016. And at that time, I wasn't seeing pregnant and postpartum moms. I was seeing a lot of chronic pain patients, and doing a lot of myofascial release and yeah, managing chronic pain. And then I, yeah, got into treating pregnant and postpartum moms with some classes that I took, and I changed my practice. A few years later, I was like, you know what? I want to focus on helping other moms. So that's what I've been doing ever since. And it just kind of naturally went into the pelvic floor therapy. Because I realized even with my chronic pain patients, I was missing a lot without knowing about the pelvic floor. So my back patients, sciatica, all that stuff, I was just missing a big piece of it. So I switched, or kind of like just refined my practice, I should say. And I love it. I love who I get to work with. And while I see some orthopedic patients that are coming in strictly for maybe pain management, I see a lot of combination, like orthopedic issues plus, hey, I have some pelvic floor issues, like you were saying earlier, incontinence, diastasis, prolapse, constipation, bowel issues, that type of thing. So,
well, I
yeah.
so appreciate you, and I so appreciate, like, I think that low pressure fitness can fit in just beautifully with your treatment style, your treatment approach, and the clients that you are now focusing on. So
Yeah.
so glad to have you out in that area doing it, and I'm sure to be back out there at some point. And I think it'll be awesome. Hopefully we can get in touch. But
yeah,
so,
great.
everyone can find you at Healing Spot PT, right?
Yep.
Is your handle?
Yep, Healing Spot PT on Instagram, and yeah, website is healingspotpt.com. Yeah.
Perfect.
And I'm excited because this, I think next month, I'm going to start doing some online teaching. So I'm going to venture into that and see how it goes, because I'm finding with some of my patients, they want more. But for what I charge per hour, they're wanting to maybe at a little bit smaller price point, let's say. So I'm going to start some online teaching with that as well, like just leading some classes. So we'll see.
Yeah.
But yeah, like you were saying earlier, I have to learn, like I'm learning from you and Alexa, like just learning different things and how to talk and all of that. So in my mind now, when I do my own little sequences at home, I'm like talking to myself and thinking, how could I teach this? I mean, I get that one-on-one, but I know it's definitely different than leading a group setting and the challenge of online, but we're going to see.
Yes.
We'll see how I like it.
Great. But it's 100% guarantee it is very different than what we're used to being a PT, where we're just working with a client at a time for the most part.
Yeah.
So it's very different to command a group. And then online is a whole nother animal, basically, right? With doing that, because you can't touch and you're at the mercy of a camera angle to some degree, right? When you're working with clients. But doing that, and yeah, I'm always sometimes just verbally exhausted.
I'm sure.
And I have these Invisalign in. I got them off. I got my new retainers in, and I feel like I'm like, giving everybody a shower. I'm like spitting everywhere. You know what I mean?
Well, you do a good job. I love your classes. I love the variety. And I often get the recordings because I either don't want to get up in the morning on weekends, I want to sleep in, or I'm kind of already starting my day by the time you're teaching on Friday mornings. But I do appreciate them. So thank you.
Thank you. Yeah. And if you need help with classes, I think I definitely love the concept of a continuum of care, with what we do in skilled PT to then the idea of that pelvic fitness with it. And us as PTs have that ability to give that education, right?
Yeah, I love it.
Can turn it into, I think, a very enriching course or class that you work with your clients. But so thank you. I always ask this question to all my guests. What is your favorite pose for low pressure fitness and why?
I really like, I would have said Maya previously, but I really like Aphrodite. So because I love like working my glutes and like bridges and squats, like I really like that. So that pose is, I would say, my favorite, and doing it asymmetrical is very challenging. So.
Yeah. And that's a, in many ways, as you said, like a glute power pose in that sense, right? It's also a great pose. One of the ones I absolutely love for the postpartum patient or anybody with prolapse experiencing that, because you're using gravity and utilizing gravity with that.
Yeah.
And then what's interesting is because, Maya, we think spring, midwifery, birth, and all of that. So you having a connection with that pose just from you as a caregiver and a personality.
Well, I was born in May. That's the other thing. And when I started low pressure fitness, believe it or not, I could not, for one, I couldn't even hold my breath, let alone do a vacuum. Like I could not for that entire first class because I was so tightened down. So for me, the reason I liked Maya at first was it was really the only pose that I could get into that I could feel like I was starting to get that abdominal and like diaphragm opening. But now that I have that, it's kind of switched.
That's good. That's good. So thank you so much for joining me. I'm out today. And it was so good to connect with you in this platform and all that. I'm sure I'll see you in a class. I'll see you actually next weekend, LPF Club. So, or is it next weekend, the weekend after, I think. So we're doing. I think
the weekend after. Yeah.
So,
well, thank you for having me. I appreciate the time and being able to connect with you and talk.
Yeah, perfect. And anybody watching, if you want to learn about low pressure fitness, if you want to become a low pressure fitness trainer, you can join us for LPF. We have a hybrid model that we do. I have Alexa Marine. She is LPF UK. She's my co-instructor. We do virtual live streaming as well as in person, so people can see all different ways of learning low pressure fitness from different perspectives too as well, which is really fun. And then as Justine joins us for the LPF Club, which we have our LPF trainers are welcome to join us for that so that they can get somewhat of a, I guess we call it a continuing education, a way of building community and being able to be there to support you and answer questions that you might have. We do special topics. We're doing LPF for the for the prenatal or LPF for the pregnant client coming up soon. So thank you all for joining us. And hello, everybody. Julie just joined. The hello girls there. And Barbara, thank you so much for the sweet thing that you just wrote on there in the comments. We appreciate your support too. And we appreciate everybody watching. And Justine, have a wonderful weekend. And thank you again. And I will see you soon.
All right. Bye-bye.
Take care. Bye.